Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great pain relieving and spinal stabilization exercise for those of you with spondylolisthesis called the modified side plank. Hope you enjoy. So what I really like about this modified side bridge or side plank for spondylolisthesis is that it can be done by people that really aren't in great physical shape, who don't have the strength to go up into a traditional side bridge or side plank. This is a great exercise because it takes advantage of conditioning the thoracolumbar fascia's tension to be able to pull the spondylolisthesis or anterolisthesis vertebra slightly back into a better alignment and avoid the tendency for it to slide forward, where it can cause pain by putting pressure on the disc fibers, the facet joint capsule, and the associated soft tissues like the muscles, tendons, and ligaments. I give this one to my patients who are older or who are not in good condition because it's really great at helping them to develop core stability in the lower back to help them prevent spondylolisthesis pain of the lower back. So we're going to do this one to both sides, right and left, but I'll show you on this one side. The bottom arm is going to be positioned up as far as we can comfortably as we're laying on the back of the shoulder blade, not right on the side of the shoulder where it can compress the joint. So on my back shoulder blade, I elevate that bottom arm. I'm going to make sure my body's pretty straight between my ear, shoulder, hip, knee, and ankle. If I have any alignment issues, such as I have a tendency to hip hike or raise one hip up or twist my ribs to one side, any posture alignment issues, I want to make sure I'm going with a square body structure. If you're not sure if you have posture alignment issues, I invite you to go to either the Pain Free and Fit or the Posture Size websites. We have a free body analysis there. You can check out what your alignment is, learn about it, and then learn how to correct it. Because if we do this exercise with any type of even the slightest tendency to rotate or to lean one way or to translate one way, it's only strengthening the dysfunction in our body, and that's actually going to put more painful stress on your lower back and aggravate your spondylolisthesis. So once we have our body structure square and in good alignment, we're going to hold our lower abdomen in. Now that's below our belly button. Now, as we pull that in, it's going to tense something called the transverse abdominis muscle, which attaches to this thoracolumbar fascia. The latissimus muscle, or the lat muscle that runs from our shoulder to our lower back, is being stretched as I bring my arm up. That also attaches to that thoracolumbar fascia. And I'm going to squeeze or tense my top buttock, not the bottom one, but the top one. The reason we do this is the thoracolumbar fascia crosses our lower back in a diagonal from the buttock on the top side across the vertebra and attaching to it to the latissimus muscle on the other side. So we're going to be strengthening that diagonal or cross strut that in this particular exercise is going to help to exert a backwards pull or pressure on that spondylolisthesis or forward vertebra, helping to relieve your pain and strengthening your ability to avoid pain in the future. So once the arm is up, the lower abdomen is pulled in and held there, and the top buttock is tightened or squeezed, we're going to also put a little tail under motion or tension. Okay, I'm trying to tuck my tail between my legs or raise my pubic bone up towards my chest, and that will help to decrease the arch of my lower back. And it also pulls that thoracolumbar fascia, the lowest aspects of it around L4 and L5, so that it produces a posterior translation or backwards pressure on my spondylolisthesis. In that position, what I'm going to do is I'm going to try to shorten my arm by pulling my fist right through my shoulder and shoulder blade. That's going to make my shoulder blade go down towards my hip. And as I keep that buttock tension, it's going to create a contraction across that whole thoracolumbar fascia, and then I'm just going to lift my hip up a little tiny bit. I can hold onto the floor with my hand for a little balance. So I don't necessarily need to bring my hips way up off the floor, just so my hip gets a little lighter on the floor. My shoulders staying against the floor, my thighs are staying against the floor, but I'm trying to lift a little bit, and then I'm just holding that contraction as I breathe normally using my diaphragm, meaning my upper abdomen is going to move in and out. And then relax. So you can start that with anywhere from a 3-second hold up to a 5-second or eventually a minute or a 3-minute hold as the months go on. You can do that for repetitions, meaning repeating the exercise for 3 to 5 reps and then increasing past there, or by doing just 1 or 2 reps but increasing the time over successive workouts which should be 2 to 3 times a week. Then, of course, roll over and perform it on the other side. So again, the key to this exercise is creating that thoracolumbar fascia by pulling the arm down, fist through shoulder and shoulder blade towards hip, while I maintain tail under and lower abdomen contraction in. That tightens up that thoracolumbar fascia, and squeezing the top buttock, which further tightens it. And then the challenge is, as I raise my hip up slightly, I'm really challenging that bottom lat muscle and glute muscle to keep that tension on in what we call a lateral stability challenge. So hope you enjoy this one. If you have any questions or comments, please leave them below. We've got a lot more spondylolisthesis exercises and low back pain relieving exercises here on the channel. I invite you to subscribe to learn more, and I hope this helps you with your spondylolisthesis pain.